All right. Participants, pop out chat. Hi again to the two people that are here. I don't know if you guys are able to comment. I can only see like a top chat pull down on my end. I'm gonna try to pop out the chat and see if that makes a difference. Pop out chat. Oh, I see. Okay. All right. Cool. Got it. Hi. Oh my gosh. Hi. I'm so sorry. Perfect. I am clearly a little technologically challenged, but I think I figured it out. I can see the chat now. Yay! All right. So I didn't have anything in particular planned for this live. I was just hoping that I could field any questions that anyone has about anything. We can talk about pelvic things, we can talk about chronic conditions, we can talk about life things, really anything. So if anyone has any questions, please feel free to comment in the chat and we can just go based off of whatever's asked. Can you guys hear me? Okay. I'll ask you. Can you hear me okay? I have an embarrassing question. Go ahead, Rob. You can ask anything so long as you're comfortable. Oh wow, 9 people. Hi. Oh, this is exciting. To anyone who just joined, I was just saying that I didn't have anything in particular planned to discuss. I was just hoping to field any sort of questions that you had about pelvic things, life things, or healing chronic conditions, or really anything. If I can be of service in any way, I just wanted to field questions. Hi, Tori. Nice seeing you. All smiley. How are you? Hi, Martina. I remember chatting with you, I think on Instagram and here on YouTube. I'm doing pretty well. I'm continuing to improve in my symptoms, which is amazing. I know I shared a recent update about how I was feeling, and it comes in waves, the challenge of staying motivated. But today I'm feeling really good. I feel mostly normal. I have like a faint little tickly feeling, but I feel mostly good today. And I'm also like very nervous and excited to be here. Someone said, not a question, but just want to say thanks for the work you do. Your vids are so helpful. Oh, thank you so much. I really appreciate you saying that. Thank you. I really enjoy creating the content, and I'm so happy that it's helpful for you. Someone said, after bowel movements, I feel like I'm having incomplete evacuation using a squatty potty, but no use. So the squatty potty isn't necessarily helping. So incomplete evacuation, or feeling like you still need to go even after you've gone, can be caused by a number of things. If you look in the toilet and the amount that you've evacuated looks substantial, like you look in it and you're like, oh, I feel as though I've emptied my bowels just based off of what I can see in the toilet, but the feeling that you have is that you don't feel complete, that might be indicative of some sort of tension in the pelvic floor. The rectum is a really interesting organ, and the way that it communicates with your brain is actually via stretch. And that's how your rectum tells your brain whether or not it's full or empty or kind of full or what have you. And if you're someone who carries a lot of tension in your pelvic floor, sometimes the rectum can misinterpret the tension that it's feeling as fullness. And so sometimes someone struggling with the feeling of incomplete evacuation, even when it looks like they're completely evacuating when they observe what's left over in the toilet, is actually struggling with some sort of pelvic floor tension going on. So that's one potential reason that you could be feeling that. I'm not sure if when you look in the toilet it looks like you're completely empty or not, but that's where my head goes first. Someone said, I just want to say that you are so cute and helpful. Just watched one of your videos and subscribed. Oh, thank you so much. That really means a lot, and your support also means a lot to me. So thank you so much for taking the time to leave that comment and for subscribing. Oh, you're welcome. I hope that that was helpful. If you do think that that might be what's going on, I do have a video on my channel that's dedicated to pelvic floor relaxation. You could always try, after you have a bowel movement, doing a pelvic floor relaxation routine, even if it's just the body scan and the deep breathing, which are the first two things I go over in that video, I think, and see if it changes the feeling. And if it does, it might be worthwhile either putting pelvic floor relaxation into your routine like every other day or something like that, or even seeking out a pelvic PT to see if maybe that's what's going on. And then Rob said, is it possible to pre-ejaculate? Because I think that has been happening. Yes, pre-ejaculation is absolutely something that can happen. That is definitely a possibility. There's actually the video that I made recently about male multiple dry orgasms. I actually found a lot of really interesting research on premature ejaculation, essentially using pelvic floor awareness and other pelvic floor exercises in order to help men become more aware of their ejaculatory reflex. Like any other reflex, once you have your ejaculatory reflex kind of hit the point of no return, it's just going to do its thing, as reflexes do. But there's a way to become more aware of sort of where that line is, and then there's a way to use your pelvic floor in order to interrupt the reflex and then prolong how long you're able to last in whatever it is that you're doing. Check out I think I called it like on male multiple orgasms or something like that, Rob, but check out that video. I link to some of those studies in the description that you could check out that might be helpful for you, but pre-ejaculation is definitely possible. Hi to anyone who just joined. I mentioned earlier, but I wanted to mention again that I didn't have anything in particular prepared for the live. I was just going to field some questions about absolutely anything, pelvic things, life things, healing chronic conditions, really any questions that you have. So if you have any questions, please feel free to ask them. Hey girl, hey! Yeah, Rob, do check it out. I think that the studies in the description might be helpful for you, and I think I start talking about my proposal to do with the ejaculatory reflex, like sort of in the middle of the video. There's timestamps. Cool. So, does anybody have any other questions? I would very happily thank you. The video I watched was abdominal massage for bloating because from what I can remember, I have been bloating a lot, even from drinking water, and I hope it will help me if used routinely. I hope it will help you too. Sometimes when someone gets bloated, even from drinking water, um, I really don't like the name given to this condition, but there's something that can happen in the intestines that the term that gets thrown around in the GI world is lazy colon, but it's essentially where the intestines don't contract or do that peristalsis, that snake eating a mouse-esque movement in the way that they should. And when someone is struggling with this lazy colon-esque phenomenon, usually when they go to see a physician, the classic advice that's given is to drink more water and eat more fiber, which can be really helpful sometimes, but isn't always helpful, especially if someone does have intestines that just aren't contracting as much as you'd want them to. And usually someone will actually experience bloating when they increase their water or fiber intake when they have that sort of lazy colon phenomenon. So that might be something worth investigating, especially if you notice that you're not only struggling with bloating, but also struggling with constipation. It's definitely worth trying, but if you're someone who does struggle with the intestines not moving in the way that they should, eating more fiber and drinking more water might have the reverse effect. But the intestinal massage is a way for you to sort of manually stimulate that peristalsis, that intestinal movement. And I have a different video about some yoga moves that you could try that might also be helpful. They're also sort of tricks to get your intestines to contract. Yeah, to contract. I love your videos. So understandable and educational. Never stop making videos. Oh, thank you so much. That means a lot to me. I definitely cool. Good. I think the yoga and the abdominal massage would be two helpful tools. The other thing to try too, there's a couple ways to sort of jumpstart peristalsis, and the yoga, the abdominal massage, those are ways that you can do that manually yourself. Other things to consider would be spacing out your meals, like eating smaller meals throughout the day, maybe 6 small meals instead of 3 large meals. That's much easier on the GI system if you're someone who is struggling with that lazy colon phenomenon. And then the other thing to try is activity after you eat. So when you're having your 6 small meals, just committing to like a 5 to 10 minute walk, even like around your house or outside or wherever, that can also be a way to sort of naturally stimulate that peristalsis, and that can be helpful. But thank you so much, Blaine. I really appreciate that comment, and I definitely intend to continue to create videos. I'm actually really excited. Keith, my husband, had this really cool idea to start creating pelvic PSAs. And so I actually just wrote one of the scripts, and we came up with 12 different ideas for pelvic PSAs, and they will essentially be these short videos, because if you watch my content, you know I can be a little long-winded. So Keefe was saying that it might be good to create shorter videos that just cover an interesting topic or an interesting pelvic health issue in 5 minutes or less. And so we brainstormed and we came up with 12 really interesting topics to cover in 5 minutes or less for these PSAs based off of questions that I get and things of that nature. And we actually downloaded Toonly, which is like a software device that lets you create like funny animations. And we made like a really cute, I think it's like 20 seconds, a really cute 20-second intro for the pelvic PSAs. So right now I'm intending to try to put 2 out a month. Right now I'm aiming for the 10th and the 20th every month. So July 10th will be the first pelvic PSA. And it'll be a short 5 minutes or less video about an interesting pelvic topic. You are welcome, Magdalena. I hope that that's helpful. Naughty said, I like your septum piercing. Thank you so much. Thank you. My septum piercing is the first piercing that I've had, other than I have my first and second like earlobe piercings, but my septum piercing is the first like cartilage piercing that I've had that actually healed. I've actually tried to pierce different parts of my cartilage on both ears multiple times, and for whatever reason, it just never took well. And so my septum piercing is the first piercing that I've had that actually healed. And all I ever wanted was like a dainty little gold ring. And I learned that this 20 gauge and this particular size is as dainty as it gets, according to all of the professional piercers that I've talked to about it. Because if I go smaller, I learned that you can actually kind of encroach on your septum and create almost like a cheese cutter effect, which I don't want. So I think this is as small as it gets. And then Blaine said, oh, I love your long-windedness. Thank you. Thank you. I don't know. I try to be as succinct as I can be, but I know that I'm a long-winded person. It's all right. I do my best. And then Magdalena said, can't wait to watch those. You got me hooked. Oh, thank you. Martina said, Tori, do you have any activities you enjoy particularly and have discovered while recovering? When I feel in pain, I just rest and watch TV shows, but I feel that I could spend my time differently. That's an incredible question, and I totally hear you when you say that watching TV, it's helpful, right? Because it's a way to escape. I found that getting myself really involved in a silly TV show of really any sort was a helpful way for me to get out of my head and like get out of my body. And so I totally understand why you might gravitate towards TV, but I also understand feeling like you're wasting your time, or like you could be doing something better or more productive or anything like that. But what I will say is that personally, I have found that getting into a really good TV show or getting into a really good movie is a really easy way for me to escape and get out of my mind and get out of my body when I need to. And I do think that the circumstances are different when you're someone who's struggling with pain, especially chronic pain, because it's hard to do productive activities when you're so distracted by what's going on in your body. And so all of this to say, I just want to make clear that I think it's okay if TV is what you use as an escape. I don't think that there's anything inherently wrong or bad about that. But what I will say is that other than watching TV or reading a book or any other sort of, I guess, classic escapism, I really find walking to be incredibly helpful for me. And I know that that's not the most fulfilling answer, and that it is kind of an obvious choice, I suppose. But for whatever reason, getting outside and moving, and I don't know, I feel like in the same way that you can sort of get lost in a TV show, I feel like when I'm walking, I can sort of forget that I'm walking and get lost in my own thoughts, or even get lost in practicing present moment awareness. That's something that I've been practicing a lot. It's something that I was practicing before I got hurt, but something that I've been practicing daily since I got hurt. And so as simple and silly as it might sound, outside of watching TV and reading books, I've really found walking to be an incredibly important and valuable part of my healing, especially through the lens of needing to get distracted. So that's always been helpful for me. Naughty Naughty said, have you thought about getting your tragus pierced? Tragus? Is tragus, is this the tragus? I can't remember which one the tragus is, but I haven't. I feel pretty good about the piercings that I have right now. I might get more in the future, but right now I haven't thought about adding any more to my ears or my face or anything. And Blaine said, that is the tragus. Yeah, I think it's a really cool piercing. I like the way that it looks. I think it would be tough for me because I wear headphones a lot when I'm editing and things like that. So I feel like the healing part would be tough on me just based off of how often I have things in my ears, you know? Blaine said I'm long-winded too. Cool. Yeah, definitely been that way my whole life. And then I'm sorry if I mispronounce your name. Is it Ankit? Ankit said, I'm trying to gain weight, but I didn't get success. You know, gaining weight and losing weight is a little outside of my scope of practice. It's not something that I would help patients with in the clinic. And I've definitely been able to lose and gain weight in my own body, working with my own exercise and nutrition and that sort of thing. But I'm not as comfortable creating videos on that topic, only because it's not something that I have clinical experience doing or a lot of personal experience doing, you know. If there's a question at all related to weight gain and pelvic health, I could try to be helpful, but I don't know as much about weight gain, unfortunately. I'm sorry that I can't be more helpful. Thank you guys for asking questions, and thanks for bearing with me during my first live. I'm much more nervous than I thought that I would be, but I'm still happy and excited to be outside of my comfort zone a little bit. It's so funny because I think the Instagram lives that I've done, the experience has been different because there's been a specific topic that we're discussing, and they've also been more like an interview style. So I'm answering questions and fielding something with someone else there, you know, and I've really enjoyed those, but this is a slightly different experience. Oh, Martina said you're doing great. Thank you. You didn't answer about gain weight. Oh, I did. I mentioned that it's not something that I did in the clinic. Helping people gain and lose weight isn't something that I practiced as a provider. And while I have gained and lost weight personally, so I do have some personal experience in that realm, it's not something that I feel very comfortable creating content about or giving advice about, only because it's not something that I'm very well practiced in. But if you have a specific question about weight and pelvic health or anything, or nutrition and pelvic health or anything like that, I'd be very happy to try and give you a more straightforward answer. I'm sorry that I can't be more helpful though. Oh, okay, I'm sorry. It's okay. Don't worry about that at all. Like I said, you can ask me anything and I'll do my best to answer. That's just an area that I don't have as much knowledge to pull from as I do other areas. see. But if anyone else has any other questions about anything, I would be very happy to try my best to answer. And if not, that's okay too. If not, at the very least, the first YouTube live has officially occurred, which is good. I feel like getting out of my, can I drink whey protein shake without workouts? Are you CO? To and Keat, can I drink whey protein shake without workouts? I'm not. Are you comfortable with sex questions? Yes, naughty. I'm very comfortable with sex questions. You can ask me anything about sex, sexual health, sexual dysfunction. Very, very comfortable in that realm, as long as you're comfortable with the question that you're asking. Magdalena said, since I'm new here, could you tell us why you started learning about all of this? Yes, absolutely. Real quick to Ann Keat, I'm not sure. I don't know why you couldn't drink a protein shake without working out. I guess it would depend on how much protein you should be getting for your body weight and your size. I'm sure that there's pros and cons to having too much protein, just like there's pros and cons to having too much of anything. But I don't think that a singular shake before a workout would be a bad thing. But yes, I am comfortable with sex questions. And to Magdalena, I actually got into pelvic health sort of on accident. It was like a really happy coincidence. When I was in college, when I was in undergrad, I was doing the pre-med track, and I was pretty set on becoming a physician and going to medical school. And what's really interesting about that is that I made that choice when I was really young. I think I was like 12 or 13 when I decided that I wanted to go into medicine. And for whatever reason, I never really questioned it. I kind of just had my blinders on about it, and that's what I was going to do. So when I got to college, I was taking all the pre-med courses that you would need in order to apply and get into medical school. But because I knew that that was the track that I was going down, I actually ended up majoring in religious studies because I think that religion is just so fascinating, and I've always had a really natural draw towards Eastern philosophies. And so I started taking some of the more Eastern courses, and before I knew it, I was only a couple of classes away from being able to get the major. So I ended up majoring in religion. But because my schedule was so funky, like I was taking all these science courses and all these religion courses, my religion professors were very aware of my pre-med track. And I actually had a religion professor pull me aside after one of my courses, and I think he was just sort of venting to me about how hard of a time, how challenging of a time his daughter was having in her residency. And we were just chatting, and it was honestly the first time in my life where I stepped back and thought to myself, oh, medical school is a 4-year commitment, and residency is a 4-year commitment. And then if I want to do a fellowship, that's anywhere from like a year to another 4 years. And do I want this? And so it was this huge moment for me. I was actually studying for the MCATs at the time, and I was young, I was like 21 or something. And so I took a step back, and I started to reach out to women who were in medicine, because at the time I really wanted to become a mother and have a family. My injury that I experienced has since changed how I feel about bearing my own biological children, but that's a different discussion, and I have a video up about that. I think it's called I Don't Know If I Want Kids Anymore on my channel. But at the time I was very focused on having a family. And so I just asked a lot of women about their experiences, and the short version of this is that all but one woman told me that if they could go back, they wouldn't do it again because of the demand on their youth. It's essentially 8 to 12 years of your youth. And they really encouraged me to think long and hard about work-life balance, and all of this reflection led me to PT, still in the healthcare realm, but sort of adjacent. And so I ended up going to PT school for my graduate program, and I was actually just sort of open to any sort of specialty. And I ended up on a 2-week clinical rotation. The clinical rotations are where you as a student are under the guidance of another physical therapist, of a licensed therapist, and you just sort of follow them around and practice and that sort of thing. And my particular clinical instructor, it was an outpatient orthopedic pediatric sports rotation, which means it was kids who had sports injuries for 2 weeks. That's what I was doing. And my clinical instructor was actually treating a 17-year-old for painful sex. And it was this huge light bulb moment where I was like, what? Like, I could treat painful sex? Like, PTs can treat pelvic issues? And it was the catalyst for me learning that this specialty existed and sort of having this like innate feeling about it, like a very passionate, oh my gosh, I'm so interested feeling that I honestly hadn't felt since studying Eastern philosophy and Eastern religion. I've really only felt this way about like animals in Eastern philosophy. And so anyway, that was the catalyst, and it was just this weird, happy accident. And then I started taking their continuing education courses in PT world. When you want to specialize in pelvic PT, you have to take continuing education courses, but they're really foundational education because you don't really learn a lot about pelvic PT in school, or at least I didn't in my program. But that's how I got here. That's how I got interested in it. It was a really happy accident. I'm really grateful for it. And then someone said, how to improve digestive system, how to deal with IBS. Magdalena said, thank you for sharing that. You're so welcome. Thank you for asking. I really appreciate the question. But to Ann Keat, I don't know if you've checked out my other videos on my channel, but I actually have a series dedicated to IBS. There's 9 videos in the series right now. And room for a lot more. I haven't made a video for that series in quite a while, and I probably should. But I think that might be a helpful place to start. I talk about what causes IBS, or what we think might cause IBS. I talk about food sensitivity, food intolerance, potentially managing IBS with diet, Linzess, Trulance by Bearsy, FODMAPs, the little FODMAPs diet. I have a lot of resources in that series that might be helpful for you if you want to check it out. Laura said, hello, I'm happy to see you. I appreciate you and your videos so much. I wish you the best. Oh, Laura, thank you. Thank you so much for taking the time to say that. I appreciate you and your support, and I really appreciate that comment. Thank you. And then we have Isla Roberts saying, how do I get my tilted uterus to not be tilted? I have chronic UTIs. I'm a 20-year-old virgin. My period pain is absolutely horrible. I was on bed rest and almost died last July. I didn't go to the hospital at all. I also can't eat fruits and vegetables because I throw it all up. I used to be able to eat fruit when I was younger. Oh my gosh. I'm so sorry that you experienced bed rest and a near-death experience. That must have been so terrifying. I feel as though I can really relate to the feeling of almost being trapped in your body after experiencing the injury that I have experienced, and I'm just so sorry that happened to you. That's a really interesting question about the tilted uterus. So what's really interesting about pelvic health world, so physical therapy in general is really geared towards evidence-based practice and a lot of like scientific Western interventions, which is great, and I'm definitely for that. But pelvic health has a little more room for more holistic, woo-woo Eastern stuff. And the idea of the tilted uterus or treating the tilted uterus, that's something that tends to kind of lean a little more into the holistic, more Eastern things. I know that there's, I almost want to say it's as ancient as the Mayans, like certain abdominal massages and different sort of fascial work that certain providers can do in order to untilt a tilted uterus. I have to be honest with you though, Isla, it's not a practice that I ever learned. It's just not something that I had the opportunity to learn when I was practicing. So I'm not entirely sure what those techniques exactly look like, but I know that they exist. And it makes me wonder if there would be a different pelvic provider who would be better versed in those sort of techniques, who would be helpful for you. But what I will say is that if you're someone who's experiencing chronic urinary tract infections, and if you're someone who has ridiculous debilitating period pain, and if you're someone who was on bed rest secondary to that pain, I really, really, really highly recommend that you seek out a provider who knows about endometriosis. I don't know if you've ever heard that term, or if that's been thrown around, or if it's come up in any of your research. But really debilitating period pain, as well as the vaginal flora. You may know that there's a microbiome inside of our guts. There's also a microbiome inside of our vaginas, and sometimes endometriosis and the vaginal microbiome being a little off and lending itself to chronic infections or hypersensitivity in that way, that can be a thing. So I don't know. If it were me and I were struggling with the symptoms that you've mentioned, I would look into endometriosis. And I can also, it has came up, but I never really knew if I had it or not at the endometriosis. Yeah, I highly, highly recommend that you start researching that. And I am just going to write this down for you. There's a website, Nancy's Nook, and there's a Facebook group called Nancy's Nook for Ayla and Endo. I'm just going to send that to you so that you have it. I skipped a question. Naughty, I didn't mean to skip your question. I will come right back to it. But Isla, check it out. Nancy's Nook, I know that there's some controversy surrounding some of their political beliefs and some of the political beliefs of their providers, but politics aside, if you're looking just for like an introduction to the diagnosis and what happens when you have endo, it's a really good place to start. So that's where I would start. Let me just scroll back up. So let's see. So Naughty, if you don't mind asking me your question again, for whatever reason, the last question I have from you is, are you comfortable with sex questions? So sometimes YouTube will just, I guess, censor questions and comments that I get on my channel, and I wonder if they do that in the chat too. If you asked a question and there was a word in it, like vagina or penis or sex, just put like an asterisk in it. That might have been what happened. I know it happens on my comments sometimes. And then Terry said, I'm so excited to see your live. Thanks for sharing your journey. Terry, thank you so much for that comment. And also thank you so much for being such a support to me and my channel. You comment and you like, and it means so much to me. And I sincerely am very grateful for your continued support. So thank you, genuinely. And then Lala99 said, hey, I've tried everything not to have period cramps anymore for over 10 years now, but nothing then painkiller helps. Do you have any tips? Lala, I would also say to you what I was saying to Ayla. Even though having really distressing and uncomfortable periods is something that happens to women, it's not uncommon, if you will. That doesn't mean that it's normal. Periods are meant to be not necessarily the most comfortable experience, but they shouldn't be distressing. It shouldn't be something where you have to not go to work, or where you have to be on bed rest, or where you can't function. So if you're noticing that you have very, very strong period cramps and you can't really do anything, in order to kind of assuage them. I highly recommend looking into endometriosis, and I also highly recommend looking into PCOS, polycystic ovarian syndrome. Both of those diagnoses can sometimes present as really long-standing debilitating period cramps. I don't know the stats on PCOS, but I do know that endometriosis affects 1 in 10% of women. And of course, those are only reported cases, so there's room that that number is actually higher. So looking into endometriosis and PCOS might be helpful for you. Let's see. And then Devin Shaw said, "You've helped me so much over the last few years. Thank you for all that you do." Devin, thank you for taking the time to leave that comment and to say that, and thank you for your support, and I'm honored to have been a positive part of your healing in any way, so thank you. Blaine said, "I learned so much about our body from you." Good. I really, truly, genuinely believe that knowing how the body functions is integral in having autonomy over your body. And I think that sometimes diagnoses and things are scary simply because we don't understand them. And I really think that understanding can deflate that balloon, that fear, that overwhelming sensation. So I'm honored that you feel as though you've learned so much about your body, and I hope that you can continue to learn about your body from my videos. Lore said, "Would you ever consider making a video about diastasis recti with tips for improving it properly mainly, or is that not really your field?" Yes, I could absolutely, hang on, let me pull up, I'm just gonna switch my screen really quick. Let me pull up my list. I keep a list of all of my requests. Let me put down diastasis. I could absolutely make videos about diastasis. Diastasis. Recti. There we go. Where was that? Lord, yes, I can definitely create videos about that. That would be an interesting series, actually. There would be a number of things that I would want someone with diastasis to understand about what's going on before going into different treatment options. So I would be more than happy to create that. I could absolutely do that. Ankit said, "Thank you so much." You're welcome so much. I hope those IBS videos are helpful for you. Isla said, would having black urethral opening and having the direction of the pee go forward be symptoms of endometriosis? Not necessarily, but the black urethral opening, oh my gosh. I'm sad that I can't remember the name right now, but there is a name for a blister that it's almost like a blood blister that can form at the urethral opening. And it's actually relatively easy to treat with a topical medication. So if you think that blackness might actually be dried blood or like a dry blood blister, I highly, highly, highly recommend that you go to either a urogynecologist or a gynecologist, or even a primary care provider who can direct you to one of those specialists, because all you need is a topical medication and that can resolve itself. It's something that I would see sometimes in menopausal women or in women who were having hormonal imbalances and some sort of thinning around that tissue. Sometimes you can get a sort of blood blister around the urethral opening. So if you think that that might be what's going on, it might be really helpful to seek out a urogyne or a gyne or a PCP just to get that topical medication. It can be really helpful. I'm also underweight. I lose 10 pounds when I'm on my period. I'm 105 pounds, I'm guessing, and I'm 5'5". Yeah, weight loss can be more concerning. I really encourage you to seek out a specialist. It sounds like there may be some sort of hormonal aspect to whatever you're experiencing. Hormones definitely play a role in endometriosis. They definitely play a role in PCOS, although what you've described sounds more like endo to me. But of course, I can't give individualized medical advice, and I have no way of knowing for sure. But I really, really encourage you, given what you've shared so far, to follow up with a gynecologist or a urogyne, and just even a pelvic pain specialist, just someone who knows more about these sort of diagnoses, because I think that you have some of the puzzle pieces that someone could use to give you a diagnosis, and that might be really life-changing and helpful for you. Naughty Naughty said, okay, I'm female. My boyfriend has a very difficult time coming during intercourse, but it happens immediately when he does it himself. He gets so close, but it rarely happens. Oh, that's a really interesting question, Naughty Naughty. I would be curious, and forgive me if this is something that the two of you have already explored, but there is such a thing as performance anxiety for men, and it can be, I don't know how old you guys are, but it can happen in younger men who are seemingly otherwise healthy, where there's a couple of experiences that they have where they don't perform as they think that they should, and then it can almost become this unfortunate vicious cycle, this self-feeding loop where they get in their heads about how they perform during sex. And one of the telltale markers is that outside of sex, they're able to perform or ejaculate without issue. And so that's where my head goes first. A conversation is always helpful, and something else that might be helpful to consider is a sexual experience or multiple sexual experiences for the two of you where the intention isn't him coming, where the intention is just the two of you enjoying each other, exploring each other's bodies, trying new things, getting lost in each other, that sort of thing, and sort of intentionally creating the space where you take the pressure, where you take the pressure of him finishing completely off the table, and instead the intention is just to play, sorry, I felt like I was going to burp, just to play and enjoy and have fun with each other, and see if maybe having, if you think about it through the lens of the mind, if he has a collection of experiences where he feels like he isn't performing well, if you can start to replace that collection with a separate collection where the intention isn't for him to finish, it's just for him to have fun and for you to have fun and for the two of you to play and enjoy one another, that might be able to quell some of his performance anxiety, if that is what's going on. Keefe gave me a bunch of hearts. Oh, hey, Mr. Man. Keefe's at work right now, but he must have just popped in. Hi. Blaine said, especially being handicapped, it's important we have good info, especially as women. Oh my gosh, yes, Blaine, I completely 100% agree. I don't know if I've shared this in any of my previous content, but I actually have a severely handicapped sister. So the handicapped disabled population is incredibly close to my heart. And I agree very much with the sentiment in your comments. Thank you for saying that. Lisa said, I have my first pelvic therapy appointment next month, and I'm nervous for the journey ahead. Do you have any tips? Well, Lisa, first of all, I'm so happy for and proud of you for seeking pelvic physical therapy. I know that it can be a really nerve-wracking specialty to seek out because it is so personal, and I just want to say I'm so happy that you're doing that for yourself. You deserve it. And also, it's totally valid and okay that you're feeling kind of nervous and shaky about the journey ahead. A couple things that I will say, tip-wise. Thing number one is trust your gut. Your provider should make you feel comfortable. Your provider should make you feel at ease. No pelvic provider should ever force any sort of pelvic exam on you. So if anything makes you feel uncomfortable or uneasy, voice it to your provider. And if your provider doesn't receive it well, know that you have full control over the situation and full control over your body. If anything doesn't feel right, you can always seek out a different provider. So right off the bat, trust your gut. Remember that you are in control. Other tips that I would say, know that even though it can feel so personal and scary, as providers, we do pelvic exams all the time. So know that we aren't looking at your pelvis or your genitals and casting any sort of judgment. It's just a part of the job. It's not a big deal for us in that way. So know that if you have any narrative in your mind about how you look or how you're presenting or anything like that, wipe that away. We don't think about that at all. I always tell the women and people with vaginas who I treat that sometimes people ask me if they need to shave or anything like that. No, like just come as you are. It's totally fine. And the third and final thing that I'll say, as far as a tip goes, one of the really beautiful, wonderful things about pelvic PT as opposed to other aspects of healthcare is that we have the gift of time. And it's okay if you don't have a pelvic exam on your first visit. It's okay if you just need that first visit to get to know your provider, to tell your story. I don't want you to feel rushed about telling your story, sharing your past medical history. And I also want to say that, of course, pending your comfort level, it's okay if you don't share everything right up front, but it really does help us to have as big of a picture, as wide and complete of a picture as we can, of you and your body and your past medical history. So even if things don't necessarily seem relevant or if things feel scary to share, it would be my hope that you are seeing a trauma-informed, holistic provider who knows how to have those sorts of conversations. So if you have the ability and space in your mind and heart to share very openly about your experiences, I think that that would be really helpful for the provider and for you moving forward. But it's going to be okay. Nothing is going to happen without your consent. And if anything feels weird or uncomfortable, just remember that you're in control the whole time and you can always seek out a different provider. Let me just scroll up here. And then Isla said, I don't have any sort of transportation to be able to go to a hospital. I live at home with my parents and they won't take me to the hospital. I don't have any sort of way to go to the hospital. Isla, transportation boundaries are definitely a real thing, and I'm so sorry that you feel as though you don't have any way to go to the hospital. I know that pending on where you live, there are different public transportation services that are offered for people in need who need help getting from point A to point B when it comes to their healthcare. So that could be something to look into. And I know that there's potential financial barriers surrounding services like Uber and Lyft, but I know that ride shares are another option. And my final recommendation would be if your parents are struggling to see that you need medical attention, which it does seem like medical attention would be really helpful for you. Maybe there is a different family member or a friend or even an acquaintance, like maybe an adult acquaintance, like a teacher or someone else in your community that you could reach out to for help, because you deserve medical care and you deserve to feel peace in your body. So I'm so sorry to hear that, and I really hope that you're able to get the transportation that you need. Forgive me if I mispronounce your name, but I think Farhad asked if there's any good foods for pelvic health conditions being a male. The answer is yes. There's definitely some really interesting evidence surrounding diet and nutrition and its relationship to pelvic health. It just depends on what's going on in your pelvis. So I can try to give you more specific information if you're comfortable sharing a little bit more about what kind of pelvic condition you're talking about. Isla said, I also don't like to orgasm when me and my boyfriend do things over FaceTime. I don't really like receiving pleasure or anything like that. I have a damaged sense of self-worth and don't feel worthy of having that pleasure. Isla, I'm so sorry to hear that, and I hope that you know that you are not alone at all in that experience. That is something that happens when someone experiences pain in their pelvis, especially pain related to sexual excitement or sexual experiences. That's a very, very human response, and it's something. The beautiful thing about it, and I don't mean to say that what you're experiencing is beautiful, but the beautiful thing about your brain is that your brain is very plastic. You're able to rewire your brain's expectations surrounding certain experiences. And so seeking help, whether that's through the lens of a physician for the potential endo or whatever it is that's going on that's causing you so much discomfort with your periods, or through the lens of sex therapy, or through the lens of pelvic physical therapy, or really any provider can help you sort of rewire that brain-body relationship so that you can receive pleasure again and feel worthy of that pleasure, because you are. You most certainly are. I also feel I clench my pelvic floor at all times, and when I relax it, it feels like something's going to come out of my vaginal opening. I have no way of being able to get help or treated for any of my health issues. That feeling of pelvic floor tension and that clenching and that feeling like something's going to fall out, that's something that a pelvic physical therapist could really help you with. And I hear you when you say that you have no way of being able to get help or treated with any of your issues, and I'm so sorry to hear that. All I can say is that given what you've shared, it sounds like you would really benefit from a specialist, and you deserve that help. And I know that it feels impossible for you to get it right now, but I want you to know that you are worthy and deserving of it, and that it's okay if you need to lean on someone outside of your familial unit, or if you need to lean on an adult acquaintance or anyone, really. Maybe your boyfriend, maybe your boyfriend's parents, maybe your boyfriend's friends, or an adult in your boyfriend's community could be helpful for you too. But what you're describing, I really think it would be helpful for you to seek medical attention. Naughty said, thank you. Last question. How soon should a person get tested for STDs after intercourse? That's a really good question. It depends on the STD. I would say anywhere from 2 weeks to 6 weeks after the sexual experience in question, depending on which STDs you're looking to be tested for. But if you're someone who's trying to be tested regularly, I'd say every 6 to 8 weeks is a good time period to allow for whatever STD it is that you're hoping to test to actually be present enough in your body to be positive on the tests. White cloudy stuff that comes out when you pee, that's indicative of a UTI, unfortunately, Isla. Have you ever seen the YouTube channel Squirming and Grubs? They are an interagent. Yes! Oh my gosh, yes, Terry. I love Squirming and Grubs. Oh, it makes me so happy that you watch them too. It's so funny you say that. I actually think that I once saw one of your comments on one of their videos, like maybe earlier this year. I have a faint memory of you commenting something and me seeing it. I think I even liked it. So really cool to know that you watch them too. I love them. They're fantastic and they fill my heart up, bring me a lot of joy. Isla said, I'm so sorry for asking you so many questions. I just never got to talk. Oh, it's okay, Isla. I understand, and I can feel the almost the sense of desperation and the relief that you get when you can finally talk about it. Know that I'm not unique. There are other pelvic providers just like me who want to give you the space to discuss everything that you've experienced, and they want to help you. Pelvic PT is such an interesting niche, and usually I think people really do get into it for the right reasons. So all I can do is just really encourage you to seek the help of a provider. And even if you're feeling hopeless or like getting transportation is impossible, just extend the question, ask other adults in your community, and see if you can't get yourself the attention that you deserve. Jennifer C. Powell said, I've been dealing with constipation for several years. I've been to the doctors, had an MRI, colonoscopy, etc. I've recently even seen a physical therapist. Nothing has helped. Jennifer, I'm so sorry that you've been navigating constipation for so long. Um, Something that I think sometimes gets overlooked when it comes to navigating chronic constipation is the rectal tissue health. I mentioned earlier in this live that the rectum is a really interesting organ because it communicates with the brain via stretch. And sometimes, if someone has long-standing chronic constipation, the rectal tissues can get overstretched. And it's a really interesting loop where, there are certain like established volumes that should fill the rectum, and then the rectum should send messages to the brain that says, hey, we're full, and then the brain says, great, I'm going to act on that urge and go to the bathroom. And if somebody has long-standing constipation, those urges can get trained to go off later and later and later in the stretch, if that makes sense. And so your rectum ends up having a lot more elasticity and stretch before you even get the urge to defecate. And then that kind of feeds into itself, and you can end up with chronic constipation. And your tests would come back normal, right? Like you would just appear constipated in the tests and everything else would be normal. And within pelvic PT, even though pelvic PT is a specialty, there's sort of areas within pelvic PT that you can further specialize into, and bowel health is one of them. So when pelvic PTs are learning how to treat pelvic conditions, first they learn how to treat female conditions, and they learn urinary conditions and a little bit of like postpartum conditions. And bowel health is something that you learn later on. And so depending on the physical therapist that you're seeing, you may be with someone who's really skilled and talented in treating other conditions or maybe the basics of constipation, but just doesn't have the further specialization and training needed to test your rectal tissue health. If it were me, I would start seeking out a pelvic provider who is comfortable using a balloon catheter. A balloon catheter is essentially a balloon that's tied to a tube, and it's deflated, attached to a tube, and it's deflated, and you insert it into someone's rectum, and then you slowly inflate it with air, and you can test how much volume their rectum is able to tolerate before they get certain urges, before they recognize that something's in there, before they have an urge to defecate, and before they can't tolerate anymore. And the wonderful thing about this balloon training is that you can use the balloon and pelvic floor contractions and endurance holds as a sort of biofeedback training for someone. And I've had really good success using this in the clinic, treating people with long-standing constipation, and sort of retraining their brain and their rectal tissue to send appropriate urges. And you might be seen by this pelvic PT more frequently, like 2 or 3 times a week for shorter sessions, like 30, 40-minute sessions, just to get that biofeedback loop retrained. If you've tried other physicians, if you've tried other pelvic PTs, but no one's tried that rectal tissue sensitivity training or balloon therapy or balloon catheter, different names for it, that's where I would go. That's one of the places where once I learned that skill, I was able to treat people who I couldn't successfully treat before. So that's what I would wonder. That's where my brain would go. Blaine said, no, you haven't. So you have personal experience with disabled women and me included. Yes. Yeah, I wasn't sure if I'd shared that before, Blaine, but yeah, I have a lot of room in my heart for the disabled population with my personal experiences in my family with my sister. Isla said, I have chronic constipation and get nauseous after I eat and never been to the gyno. Endo can affect the intestines and the rectum, and it can contribute to constipation. Isla, I remember you saying that you're 20. It depends on the person when they start going to the gynecologist. And it also depends on the physician whether or not they'd be comfortable doing certain examinations if you are a virgin. I remember you mentioning that. But I can only encourage you to seek out medical attention. I can't give individualized medical advice, and I want so desperately to be able to help you, but I can't assess you myself. The puzzle pieces that you've shared with me, I would really start researching endo. The other option that I can't believe I didn't mention is telehealth. Isla, you could seek out a urogyne or a gynecologist or a pelvic pain specialist or an endo specialist via telehealth and have a conversation with them like this. I can't believe I didn't mention that. I'm so sorry that I spaced there, but telehealth. Seek out telehealth options. That way you don't have to travel anywhere. You can just have this sort of conversation, and a provider can take your past medical history and maybe help you. And you can mention that you have difficulty with transportation and see if they don't offer that sort of service that we were talking about earlier in the live. Lisa said, "Thank you so much for your answer. Your content has been really helpful and comforting as I start my pelvic healing process." Lisa, you're welcome. And again, I'm so happy that you're seeking out pelvic PT. I really hope that it's helpful for you, and it's an honor to have been helpful for my content, to have been helpful for you on your journey. And if you have questions or content suggestions or anything like that, of course, feel free to comment on any of my videos or community posts or Instagram or anywhere, and I'll do my best to respond as fully as I can, always. TD Star said, hey. Hey, TD Star. And it hurts every time I press on my pelvic bones for providing no transportation. Isla, yes, Isla, everything that you've shared about chronic constipation and bleeding and this damaged vein, I wonder if maybe that's secondary to straining. Sometimes if someone's chronically constipated, they'll strain a lot, and that can have that effect on veins. It can damage the vessels. So telehealth. Isla, I'm so sorry I didn't mention that before. I really, really, really highly recommend seeking out a specialist and looking for telehealth options. They're very, very real, especially during COVID. Telehealth became even more popular. So I know that a lot more specialists are offering that service after the pandemic. Let's see. Oh, Mr. Keefe asked us a question. He said, "What is medical literacy, and when should a patient speak up regarding understanding of plan of care?" That's a fantastic question, Mr. Mann. Keefe's also a healthcare provider, and medical literacy is something that the two of us discuss often. Medical literacy is the term given to understanding medical language. If anyone watching has ever been to a provider and the provider has used anatomical terms or used pharmaceutical terms and not taken the time to explain them, that's the provider speaking medical language, and that's the patient not necessarily being medically literate. And this is true in any specialty, right? Like if you look into the stock market and the financial world, there's such a thing as financial literacy. And when you start reading those books and trying to understand that stuff, it can feel like a second language. Same is true in medicine. There's really a whole nother language surrounding the body, surrounding medications, surrounding the different bodily systems. And it's so frustrating because providers aren't given a lot of time with patients, and I think that sometimes they're just trying to get through what they can in the short amount of time that they have, and they speak this medical language without taking a second to make sure that the patient actually understands what the provider is saying. So that's what medical literacy is. And as far as speaking up regarding understanding plan of care, immediately. If you do not understand your plan of care, if something was said to you that doesn't make sense, if someone is using a lot of medical terms and it's just not clicking with you, don't feel embarrassed. It's okay. Unless you're a healthcare provider, why would you understand the world of medicine? Why would you know that language, right? So it's okay if you don't understand. Do not be embarrassed. Know that you deserve to understand your plan of care. That is something that is happening to you, and you always, always, always deserve to understand and actually know what's going on, actually know what you're consenting to. So do not ever hesitate to ask a provider to further explain what they mean when they're describing a plan of care. If the provider tries to explain and they don't do a good job, you don't have to consent right away. You can always record conversations. You can always go into an appointment with your phone and just tell your provider, hey, I'm not medically literate. I'm just going to record this so I can do research later. Then you can record the conversation, take it home with you, listen back to it, start Googling, trying to better understand some of the language that was used and what was said, understand as best you can, and then either send an email to, schedule another appointment with, get a telehealth appointment with that provider and be like, hey, this is my newfound understanding of what was said. Am I getting it right? To make sure that you actually know what you're consenting to. I just don't ever feel as though a healthcare provider gets the final say in what happens to you and your body and your plan of care. That belongs to you, and it always belongs to you. Healthcare is a service industry, and providers are there to serve you. So understand. Be sure to speak up if you don't. Understand your plan of care before you consent to it. Always. Let's see. Naughty Naughty said, thank you for what you do. You're welcome, Naughty Naughty. Thank you for hanging out with me and asking me questions and watching my stuff. Isla said, I'm always stressed out. We've just moved away from my old house because wow. Oh my gosh, Isla, that's incredibly stressful. Wow. I'm so sorry. That would stress me out too. Oh my gosh. That's very understandable. That sounds really scary and anxiety provoking. Jennifer said, yes, I've had that test done. I saw my pelvic PT 6 months every 2 weeks, but I didn't have much improvement. So Jennifer, there's a difference between anorectal manometry, which also uses the balloon catheter it's a singular test. It happens one time. Anorectal manometry uses a balloon catheter. There's a difference between getting the anorectal manometry test and then having a pelvic provider actually use the balloon catheter every appointment. I'm not sure if that distinction makes a difference in your experience. Did the pelvic PT that you were seeing actually use a balloon catheter every appointment in order to help retrain your rectal tissue, or did you only have that anorectal manometry exam the one time? Because if you only ever had the anorectal manometry exam once, that can be really helpful. It can be really informative, but that's different than actually using the balloon catheter consistently as a form of rectal tissue retraining. But Jennifer, I'm so sorry that you haven't found improvement. I know how frustrating chronic conditions can feel, and I know how difficult it can be when you seek out different interventions and they don't work. I know that it can start to feel really hopeless or like your case is impossible to crack, but that's not true. Bodies are amazing. They're so resilient. They're so good at healing. It's really just about figuring out what supportive environment your body needs to heal. What does the right healing environment look like? And so know that just because other providers haven't been able to figure out what that supportive environment feels like, looks like, that doesn't mean that the supportive environment doesn't exist. Don't ever give up on your body. And if you haven't had a pelvic PT who's been able to use the balloon catheter retraining over and over again as a sort of biofeedback retraining, that might really be worthwhile, different than anorectal manometry. Blaine said, I don't know if I told you I have CP. Blaine, you did. Cerebral palsy. My sister, that's what my sister has. My sister has cerebral palsy. Naughty Naughty, I see that one of your messages was retracted. I don't know if you did that or if YouTube did that. But then I see sometimes it appears that drinking water hurts or upsets the GI. Seems weird though. Yes. Naughty Naughty, I don't know if you were in the chat earlier on in the conversation, but there is such a thing, and I hate the name of this condition. It's called lazy colon, or at least that's what it's called in GI world. But it's essentially a name given when the intestines don't contract. They don't have that peristalsis, that snake eating a mouse movement. They don't contract at a normal speed. And when that happens, If someone's told to increase their water intake, increase their fiber intake, usually they'll just end up bloated. And so if you're someone who has noticed that when they drink a lot of water or increase their fiber intake in hopes of treating constipation, that it actually has the opposite effect, it might be helpful to start looking at other natural ways to jumpstart peristalsis, like abdominal massage and some yoga moves, both of which I have videos about here on the channel. Also, eating smaller meals throughout the day, like 6 small meals throughout the day instead of 3 larger meals, as well as activity after meals, just like getting up and moving a little bit, like 5 to 10 minutes of walking around your apartment or outside. Can be really helpful. Those are natural ways to jumpstart peristalsis. So you're not alone in your experience. If you're someone who was told to drink water, you drank water and it just made you more bloated. That's something that happens sometimes. Isla, I dropped a 5-gallon bucket of dirt when I was lift and hold it on my pelvic bone in my accident. Been strong ever since. Isla, I'm so sorry about you dropping that 5-gallon bucket of dirt. Sometimes when the body experiences a trauma, it will tense up in order to protect you, right? Like if I was going to punch you in the stomach right now, you'd want your abdominal muscles to tense up to protect you. It's a very kind response. And sometimes when someone experiences a trauma like that, something heavy drops on them, the abdominal muscles, the pelvic floor, and the fascia, which is the connective tissue that lives underneath the skin, will tense up and sort of become more rigid in order to protect someone, protect their person. And even though their intentions are so good, they can forget to let go. And sometimes when that happens, especially in the pelvic floor, it can affect orgasm. And the reason is because if you think about what an orgasm is, right? Like if we're going to pretend like my bicep is my pelvic floor. If you look at what an orgasm actually is, it's just the repetitive contracting and relaxing of the pelvic floor. So right? Like this is an orgasm and then it gets faster and faster and then you have a big relax. And if you have this trauma happen and your pelvic floor is still really tense, that means that instead of resting sort of in the middle where we'd expect it to, maybe it rests up here because it's trying to protect you still. And then when you go to orgasm, you still have some contractions, but they're not as big. And then the relax isn't as big either. You sort of get like a minimized relax. And so you're still able to orgasm, it's just not as intense. That would be something that a pelvic PT could absolutely help you with. Pelvic floor relaxation exercises, fascial release, muscular release. The abdomen and pelvic floor are synergists, which means that they're very intimately connected. When one's turned on, the other's turned on. So if your abdomen and pelvic floor sort of both were recipients of this trauma, they could be feeding into each other, like feeding that tense state into each other. That might be what's happening. And it might be really, really helpful to seek out a pelvic PT, even if it's just through telehealth. A pelvic PT would be able to visually do some assessment and maybe be able to give you some exercises and different self-manual work that you can do on your body to help release some of that tension and get those orgasms back to their natural state. I'm concerned if I won't be able to have a child later on, being that I want to be able to have a child before 25. That's an incredibly valid concern, Isla. I totally hear that. Endo and its relationship to fertility is something that's still being studied. There's some evidence to suggest that it affects fertility and some evidence to suggest that it doesn't. Not saying that you have endo because I can't diagnose you at all, but if that is what's going on, there's no real way for the science to say one way or another whether or not that fertility is affected, or at least that's what I knew the last time that I researched it. I don't know if there's new research on there, but that's an incredibly valid concern, and you're allowed to feel that way, and I'm sorry that you have to experience that. Blaine said, a bridge is made by a medical doctor to record medical conversations, and it transcribes it for you. Oh my gosh, Blaine, awesome, a bridge. That's fantastic. I wonder if a bridge would ever consider a sponsorship. I would totally let a bridge sponsor some of my stuff. I definitely, yeah, that's a different conversation. But that is so cool. Yes, Blaine. And anyone else who doesn't feel as though providers always use language that makes sense to them. An app like a bridge, that sounds amazing to record conversations. Isla said, my mom had tried kicking me out over the last 3 weeks. I've had so much problems in my domestic life in the past month since we've moved. I don't have a job and can't get one due to being super far from the city and having no job experience. I'm so sorry, Isla. It sounds like you're balancing a lot of really difficult things in your life right now. I really wish that I could be more helpful for you outside of recommending telehealth and recommending that you further look into endo as a potential reason for some of the things that you're experiencing. All I can say is that you deserve to feel loved and supported, and you deserve to feel peace in your body, and it really makes me very sad that you're not experiencing those things right now, and I really do hope that you're able to find the strength to seek out the right providers and to get yourself out of a situation that sounds like it's not serving you well. And I don't mean to put that on you at all, and I don't mean to blame you for it because it's not your fault, but if you can find the strength to rely radically on yourself in this situation, I think it will serve you well. Radical self-reliance is the only way that I've been able to heal myself from my previous medical conditions and get myself out of challenging situations. So radical self-reliance, if you can, might be really helpful right now. Jennifer said, I had the one-time exam. My PT did pelvic exams and gave me exercises to do at home. My appointments lasted about 20 minutes. Yeah, Jennifer, I really wonder if maybe a pelvic PT who knows how to use that balloon in order to actually retrain rectal tissue sensitivity would be worth seeking out. Anytime that you call into a clinic, you can ask the front desk if the pelvic PT that's been assigned to you for your initial evaluation has training in balloon, catheter, rectal tissue sensitivity, biofeedback. You could say that you've tried quite a bit of different interventions, that you've tried a more traditional pelvic PT regimen and that it didn't help you, and that you're starting to suspect rectal tissue sensitivity might play a role, and that you want to be with a pelvic PT who knows how to use the balloon catheter to retrain the rectal tissue. I would be super curious if that would be maybe the missing piece. Sometimes the other interventions that surround constipation are helpful, but they are not effective unless they're fused with whatever the core issue actually is. And if the core issue is actually rectal tissue sensitivity, then those outside interventions just aren't going to have the same effect unless they're paired with that rectal tissue retraining. So don't hesitate to ask the front desk. Don't hesitate to be like, I'm really only interested in seeking out a provider who knows how to use this balloon retraining, because I think that that might be a really helpful intervention for you to try. And I also don't think that it's as common, right? Like I mentioned, bowel within pelvic PT, bowel dysfunction is something you can further specialize in, and not all pelvic PTs know how to use that balloon. Isla said, thank you so much for helping to get most of my questions answered. You're welcome. Keefi's back, and Keefi said, how can patients take an active role in their health journey? How do you approach health issues? Oh, thank you, Mister. Those are really good questions. So I think I've mentioned in previous posts or previous videos that I sort of take a 4 pillared approach to my own health issues. The first is relying radically on myself. I think that sometimes in medicine, especially just the way that Western healthcare is set up, it's really easy to start developing these almost not necessarily like hero victim-esque relationships, but like authority and someone who receives demands sort of relationships with providers. And it's an unfortunate power gradient, and it can kind of make someone feel as though their health belongs to the provider. But that's never the case. That's never true. Your body and your health belong to you. And taking full responsibility of that and relying radically on yourself and looking at the advice of providers and the ideas that providers propose through a different lens where you're sort of recognizing that they definitely know some things and they have some really cool things to offer, but that it's still their opinion, it's still their best idea of what will work for you, and kind of marrying their opinion with your own understanding of what's going on has served me incredibly well. So radical self-reliance, I can't preach it enough. I really found that that's been an incredibly helpful part of healing for me. And kind of falling off of radical self-reliance is embracing trial and error, recognizing that all interventions are trials, that there's no such thing as a one-size-fits-all in any aspect of health, pelvic health or otherwise, and sort of approaching each intervention as though it's a trial. And if it doesn't work, sort of managing expectations around the outcome, where either this trialed intervention is going to help you, and that's fantastic, or this trialed intervention won't help, and you can use that information to bring you one step closer to the intervention that will. So radical self-reliance, embracing trial and error, trusting your intuition. I know that that's kind of leaning more into like the Eastern woo-woo stuff, but what I will say is that no one knows a body better than the person living in it. And if you have a sort of intuition surrounding a pharmaceutical or an intervention, or maybe the mechanism of injury, what you think is causing your dysfunction or whatever, follow it, trust it, cultivate that relationship with your body. I really do think that we are much more connected to our bodies than we realize. And I really do think that intuition can be much more powerful than we realize. So I'm a big proponent of trusting intuition. So radical self-reliance, embracing trial and error, trusting your intuition, and believing in your body's ability to heal. Not to say that mind-body is the only kind of intervention space for people. I don't think that that's true at all. I think that mind-body stuff can be incredibly powerful and helpful for some of us, but that it's not going to work for all of us, and that's okay. But one of the tenets of mind-body is that bodies are innately capable of healing, and that we need to trust in their healing power. And I really do think that while there is such a thing as permanent conditions, and while there is such a thing as permanent damage following an injury, I really do think that in the Western world, things get the label of being permanent, the label of being chronic, when they are in fact curable. And so really leaning into trusting in your body's ability to heal, trusting that your body is on your side, trusting that your body is always trying to make you feel better. It's always leaning towards health as opposed to leaning towards pain, can be really helpful. So you should be as active as a participant as you possibly can in your healing, in my opinion. And the way that I've healed my previous chronic conditions, and the way that I'm chronic conditions, and the way that I'm healing the one that I'm navigating right now, relying radically on myself, embracing trial and error, trusting my intuition, and believing in my body's ability to heal. I really do think that those four things are what have gotten me to where I am today. If I had gone down the traditional Western route and just assumed that everything that every provider told me was right, and all of the interventions that that they gave me were the right ones for me to follow, I would be turning 30 and I would have 4 chronic conditions, and I would be taking at least five, if not 6 pharmaceuticals every day. There's nothing wrong with pharmaceuticals. I'm not against pharmaceuticals. I do think they're overprescribed, and I do think that they're sometimes prescribed without the patient being told what the short and long-term effects are. I just think there's a lot more room for collaboration when it comes to pharmaceuticals, but regardless, I would be turning 30 with 4 chronic conditions, taking 5, if not 6 pharmaceuticals every day, and instead I'll be turning 30 hopefully with none. Hopefully the one that I'm healing right now will be totally healed by then, and I'm taking a sugar and a mushroom every day. So rely radically on yourself, embrace trial and error, trust your intuition, and believe in your body's ability to heal. Big, strong pillars of what's helped me and what I believe can help others. Terry said, I know you have mentioned your love of animals before. Whenever you are able to, what is the first animal you and your husband would like to get together? Terry, it's a dog. It's a dog. We wanted to get a dog for so long, but it just hasn't been the right time. Originally, because we were traveling, and then after the pandemic, when we landed back home, it was because I got hurt. But 100%, we really want to get a dog. We either want to adopt, or we actually just recently met someone who's breeding a dog, breeding her dog because her medical bills are so overwhelming, and so she wasn't originally going to breed, but she's breeding now, and she's trying to use the puppies to raise money to pay off her medical bills. And ethically, I would feel really good about supporting that cause, but I still don't know if it's the right time. But Terry, 1,000,000%, we really want to get a dog. And after a dog, honestly, the animal that I would love to have and learn how to take care of, actually 2 animals, are cows and pigs. I have a huge soft spot in my heart for cows, and I don't know why. I've just always felt like naturally attracted to them, and they're so sweet and kind and loving and curious and timid. I just would love to get to know a cow and get to raise a cow. And pigs are brilliant. They have like the intelligence of a 3-year-old human toddler. I just think it would be so fun to have a pig like inside the house, like a dog pig. But dog for sure, and then cows and pigs I would love to have, and I think Keefe and I will be able to realize that dream, especially when I'm way on the other side of my healing. I think it will totally happen. Thank you for that question. Isla said, you don't know how much this conversation and seeing you live has helped. I started taking D-Manos because of your videos about UTIs. Oh, Isla, I'm so happy. I'm so happy that this has been helpful for you, sincerely. And I'm sorry that I can't be more helpful. But hopefully you can feel empowered to seek out telehealth at the very least. Maybe that could be a more manageable place to start. Blaine said, I think it will help you find medications if needed, and it saves the bullet points too. Awesome. If anyone doesn't know what Blaine is talking about, she's talking about a bridge. It's an app made by a medical doctor that records medical conversations and transcribes them for you that I just learned about through her, based off of a previous conversation that we were having earlier in the live. So yes, a bridge sounds incredible, Blaine. Thank you so much for bringing it up here. I think that's a resource that others could really, really find helpful, so thank you. And then Isla said, you've helped my UTI so much, and I've been watching your videos over the past. I'm so happy that D-Manos has been helpful for you. D-Manos also changed my life and continues to be a huge part of why my quality of life is so much better than it was when I was suffering from chronic UTIs. Red raspberry to see if it helps with my period pains. I hope it does. Less severe since taking D-Manos. That's amazing. On bed rest due to the injury. It's healed up, but it still affects me. And underdiagnosed lumbar scoliosis. I also noticed that every time I eat sugar, UTI comes back. Diabetes runs in my family. My parents don't have it, though. Laura, this is live. I am still live right now, not recorded yet. Isla, I'm so sorry that on top of everything else you have undiagnosed lumbar scoliosis. Scoliosis isn't something that I'm as familiar with treating, only because it isn't something that I treated as a pelvic provider. Usually that's not a diagnosis that someone, that's not, pelvic PT isn't the provider that someone with that diagnosis seeks out. But I know that it's not something that can necessarily be reversed, but I do know that it's something that can be improved. Probably later on though, right? First, might be more helpful to take care of the painful periods and figure out what's going on there before worrying about scoliosis. Yes, so true, yes. I know I said, Naughty said, I know I said last question, however, do you think adding lemon slices or cucumbers to your water helps the digestive system? Thank you. That's a really good question. Adding lemon slices or cucumbers to water helps the digestive system. I know that this answer is probably one of the most frustrating answers to receive, but I'd probably say it depends on your digestive system and what you're hoping to get out of the lemon slices and cucumbers. I would be curious about lemon slices and citric acid and what kind of role that could play in helping someone's digestive system. Cucumbers, I don't think, are as acidic, but I know vegetables in general, with some exceptions, tend to be helpful through the lens of fiber. And you wouldn't necessarily get the insoluble fiber from actually eating the cucumber, but you'd get the soluble fiber from its juice, which can always be helpful. So I think it definitely depends, but I can see the potential benefits from the citric acid in lemon, and I can see the potential benefits from the soluble fiber in cucumber both being helpful for someone's digestive system, depending on what they're trying to treat. Blaine said, have you watched the Frey Life YouTube channel? I haven't, but thank you so much for the recommendation. If it's anything like Squirmy and Grubs, I'm sure that I would love it. So I will definitely take a look at Frey Life. And Isla said, thank you so much. I really appreciate this live. Any sort of supplements I could take that could help constipation, period pains. Also, what are some natural herbs for birth control? I'm planning on losing my virginity soon when I meet up with my boyfriend in several months. I'm really glad this live has been helpful for you, Isla. As far as supplements that can help with constipation and period pains, unfortunately, supplements can be really helpful for both of those things, but it really depends on the person. And because I don't know you or your past medical history or your diet, and I can't necessarily assess you, I can't recommend a supplement specifically for you. But I do recommend doing some research. I'm a big fan of anecdotes when it comes to trying to treat something that's a little more mysterious. And I really like reading people's comments on Amazon and other places where you can buy supplements. And I tend to really take my time and read all of the comments. That's one of the ways that I got convinced about D-Manos. My friend with the spinal cord injury recommended it to me. I looked it up online. I started reading the comments, and I was like, oh my gosh, I think there's more than just one anecdote here. This seems helpful. So if there are any supplements that come up in your research, I highly recommend reading the comments and just getting to know the anecdotes to see how other people have benefited potentially from those supplements. And then as far as natural herbs for birth control. So I don't know enough about herbs and other more natural ways to implement birth control outside of the fertility awareness method, which is where you track certain physiological signs that indicate that you're ovulating, like your temperature, the position of your cervix and your cervical fluid, your discharge. Outside of that natural birth control space, it's harder for me to get behind the idea that there's herbs that could act as a natural birth control, maybe because they change your hormone levels. But I'm not sure of herbs that would act as a natural birth control, and I don't feel comfortable recommending any since it's outside of the fertility awareness method. I'm not sure. I think it's really exciting that you feel comfortable enough with your boyfriend that you feel like he's the one that you're ready to lose your virginity to. That's really exciting. But I will say that given what you've shared about your experiences with your pelvis, if anything feels painful, losing virginity can be uncomfortable. It can feel like a lot of pressure. It can feel just weird, like space-occupying sensations and that sort of thing. That's all normal. But pain, like real pain that makes you want to stop or makes you feel like you want to cry or anything like that, that's not normal. And I think that it would be really beneficial for you to voice that. If you start to feel like anything feels off, tell your boyfriend. Do not assume a sacrificial role in any sort of sexual experience, especially losing your virginity, okay? So just be mindful of the difference between like pressure, discomfort, space occupying, and pain, okay? I just don't want you to have, I don't want you to feel like you have to sacrifice yourself because you don't. Let's see. After Coffee with Jess said, do you have any info or tips on weaning off of PPIs? Yes, After Coffee with Jess, I do. I'm just going to write this down for you. After Coffee with Jess, I'm going to grab the video that I made, and I'm going to link it for you here. Let's see. Videos, and where are you? There you are. So let me share this. Copy, and we're back. Here you go, Jess. There you go. After Coffee with Jess, I actually successfully weaned off of PPIs after being on them for 10 years. I essentially figured out that birth control ended up being the root cause of what was messing with my upper GI system. I had been prescribed PPIs when I was 16 years old. I don't blame the provider at all. I think that my doctor was really just doing the best that he could with the information that he had. But as you know, PPIs aren't the best thing for you, especially with long-term use. And after eliminating the root cause, which I do think was my birth control, and pairing it with a weaning program that was essentially me lessening the amount of PPIs that I was taking every day, and then pairing them with H2 blockers, I was able to successfully wean off of PPIs. And I go into as much detail as I possibly can in the video that I linked. Oh, you said amazing, thank you. Yes, you're welcome. I go into a lot of detail in that video, so hopefully that can give you a much more detailed response to your question. But if you have any questions after you watch that video, feel free to comment, and I will do my best to answer to the best of my ability. But it's really exciting that you're looking to wean off of PPIs. I think that's a really positive health decision, and it certainly has been a positive decision in my health. Let's see. They are a married couple with the wife has CF. The wife has cystic fibrosis. That sounds like a really good channel for me, Blaine. Thank you so much. Isla said, Queen Lace is one I've heard of. My cycle is too all over the place to be able to track. Yes, I hear what you're saying, Isla. That is one of the trickier parts of the fertility awareness method. If you do have an irregular cycle, it can be a little harder to trust the results of the temperature, especially. I'm trying to think if I know anything about irregular cycles and the fertility awareness method. I think I may have in the past, but I'm blanking now. I'm not sure if I have any information to share with you, unfortunately. But I know that you can't be the first person with an irregular cycle who's interested in natural forms of birth control. So it might be helpful to start researching in that space and see what comes of your research. And also, depending on your boyfriend and his relationship with himself and his penis, and how well he knows his own ejaculation and ejaculatory reflex. The pull-out method is something else that you could look into. This is not me saying that that's what you should do. It really depends on the person, and it especially depends on the man or the person with the penis and their relationship with themselves and that through that lens. But my husband and I have been using the pull-out method for a long time now, like 3 or 4 years, I want to say. And I think that because Keith has such a strong relationship with himself through that lens, we've been able to implement the pull-out or withdrawal method with 100% accuracy. We've not had any pregnancy scares, so that's not me saying that that's what you should do. I just wanted to throw it out there in case it's something that you wanted to research and talk to your boyfriend about. But again, heavy emphasis on his relationship with himself, because it's definitely something that the intention can be there, but then the execution can be poor because someone doesn't have enough practice or they haven't built that relationship with themselves well enough. He does know of all my conditions, and he's extremely supportive. I'm kind of concerned because he's quite big, if you know what I mean. I do know what you mean, Isla. I'm so happy that he's so supportive of you. You deserve that. You 100% deserve that. Maybe when he comes to visit the two of you, or maybe even before he visits, maybe he would be open to helping you with telehealth, helping you do some research, helping you find a provider who offers telehealth so that you can get the ball rolling and get to the bottom of whatever it is that's causing you so much distress. I'm so glad that you have a supportive person in your life, though. You deserve that. And as far as him being bigger, I stand by what I said before. Do not assume a sacrificial role in this experience or any sexual experience, okay? If anyone is interested in tracking their cycles for birth control, there is a YouTube channel on a woman who does classes that has more info. Oh my gosh, cool, Terry! I feel like I would like FemHead. Awesome. Thank you for recommending that. If you like, I can send you a link to the Abridge app. Yeah, Blaine, go ahead. That would be super helpful. Thank you. And then, let's see, Gunjan2 said, my 12-year-old son is having fecal impaction, giving 4-packet Laxapeg daily according to the doctor, and giving oil enema since 1 week, but no relief. Please help anyone. Oh. Gunjan2, I'm so sorry that your 12-year-old son, has fecal impaction. I really wish that I could give you some advice or guidance. Unfortunately, fecal impaction isn't something that I treat or have treated in the clinic. It's outside of my scope of practice. But all I can encourage you, and well, your son's only 12, so all I can encourage you to do is make sure that you do your research, make sure that you understand your son's plan of care, make sure that you feel supported by the healthcare team, and that your providers are really taking their time to explain why they're doing what they're doing. And if anything feels wrong or uncomfortable, don't be scared or hesitant to speak up about that. And I really do hope that your son is able to find relief. I know fecal impaction can be really uncomfortable, and I'm just so sorry, and I really wish that I could be more helpful, and I'm sorry that I can't. Naughty said PPIs. Naughty PPIs are proton pump inhibitors. They are a pharmaceutical that you can get over the counter, and sometimes they're prescribed depending on how strong they are, how strong the dose is. But they're used to treat chronic heartburn. PPIs, proton pump inhibitors, H2 blockers, histamine 2 blockers. Those are both pharmaceuticals that are over the counter and prescribed to treat GERD, gastroesophageal reflux disease, which is another word for chronic heartburn. Isla said, he's been practicing on the pull-out method by himself. He's been helping me with research. Well, thank you so much. Oh, that's great, Isla, that he's so helpful and that he's been practicing. Isla said, well, thank you so much. One last question. What's any tips for losing your virginity for the first time? And any tips I can help my boyfriend in terms of the pull-out method? And it's scary not having much control over the situation in terms of the pull-out method. As far as tips for losing your virginity for the first time, I think that comfort is incredibly important. So making sure that you are in a comfortable setting and that you feel comfortable surrounding the situation, which it sounds like you do. As you may know, discomfort, stress, and anxiety can show up muscularly in our bodies. It sounds like you've experienced that, excuse me, with pelvic floor tension before. So you want to do everything you can to promote pelvic floor relaxation during the experience. So just making sure that you feel comfortable going in is huge. A second thing to understand is that the vagina, when someone is sexually excited, naturally lubricates itself, and it also elongates and widens during sexual excitement. So making sure that you have plenty of foreplay, making sure that you are feeling very sexually excited before he enters you can be incredibly helpful. A third tip, lubricant. I know that lubricant doesn't necessarily sound very sexy, and sometimes there's this interesting attachment that some women can create and people with vaginas can create where they feel like they shouldn't need to use lubricant. Use lubricant. It is 100% okay and helpful. I think that making sure that you're well lubricated and he's well lubricated can add to the comfortability of the situation. And even though sometimes too much lubrication can desensitize the experience, I would so much rather you guys use too much than use too little. And a fourth and final tip, I have some videos about this on my channel that you could check out, Isla. But if you're concerned about the size of your boyfriend, you could look into dilators. I know that this is a really unfortunate comparison, but I don't know what else to compare them to. Dilators kind of look like dildos, but they're not dildos, and the intention behind them is therapeutic, not sexual. And they come in varying lengths and widths. They're a form of graded exposure therapy. The level 1 dilator is the size of my finger, and then they slowly increase in length and width as you move up in levels. And dilator therapy is something that might be helpful for you in preparation for intercourse with your boyfriend if you're concerned about his size. I have, I think, 2 different videos up right now, but I have one that's more clinical. Hang on, I'll find it for you and I'll link it in the chat. Just give me 1 second. That has more information about dilators and how to use them. It's something that you could do on your own. It's something that you guys could even do together as almost like a warm-up. That way your vagina isn't anticipating one giant stretch all at once. Instead, you're just sort of slowly working your way up to that stretch. And again, it's something that you could do together or something that you could do on your own. Here's the video. Let me just get the link for you. Share, copy. Okay. And let's go here. Dilators. Blaine said I sent it. If you use it, let me know what you think. That's a link for a bridge. Okay, cool. Thanks, Blaine. I'm excited to check it out. I'm also excited to potentially promote it. It's always hard to find products that I can actually get behind, like outside of D-mannose, obviously. I know I promoted boric acid, which is something that I can really get behind. I would definitely promote like the dilator set that I use. But outside of those things, it's hard sometimes to find products that I can actually get behind. And a bridge sounds like one that I could really support, so thank you. Isla said, I also have a minor tear on the outside of my vaginal opening. It's been there for 10 years and never healed. Oh, Isla, I'm so sorry. I wonder if that has anything to do with your hormone levels. Sometimes hormones can affect the, integrity of your vaginal skin. And depending on which hormones are affected, sometimes the vaginal skin can become thinner and not get as much blood flow, not be as plump as healthy vaginal skin is. And that can make tears become chronic or make them really challenging to heal. Of course, your body, your choice, you can do what you want surrounding that micro tear and losing your virginity. But of course, it would be optimal to not have a tear going into your first experience, as there's a risk that intercourse could make the tear worse, and I certainly don't want you to tear or worsen a tear. No problem, girl. Glad to help. Yay, thanks, Blaine. It involved an end of a magnifying glass. Oh my gosh, Isla. I'm so sorry. I'm so sorry to hear that. All right, well, we have been on this live for almost 2 hours. I really need to go to the bathroom, and I'm thirsty. But if anyone else has any other last-minute questions, I would be happy to try and answer them. Otherwise, I think I'm going to call it and eat some food. Thank you so much. That's all of my questions. Isla, I'm happy to help. I'm glad that I could be helpful. Seek out telehealth. I really think that's a good place to start. Naughty Naughty said, thanks again. You're welcome. Cool. So thank you all so much for attending. What a cool experience. I really enjoy lives. I was definitely nervous in the beginning, but turns out that this is a really fulfilling experience on my end. I would be happy to do this again in the future, either here or on Instagram, and hopefully I'll have more interviews, more like Insta Live interviews lined up for you guys in the future. And just, I'm lucky to have you for support. I'm so thrilled being able to get my questions answered. Oh, you guys, thank you. Thank you, Isla. Maybe I will do more lives more often. But I just want to communicate to anyone who's still on the live and anyone who's watching this recording after the fact. Just thank you so much for your continued support. I really can't tell you how much it means to me, and I know that sometimes it can be trite for people with platforms to say things like, I wouldn't be here without my supporters and that sort of thing, but you guys really do give me so much life and excitement and joy, and your support really does mean the world to me, especially since my channel is about pelvic health and YouTube doesn't always like to promote my stuff because I talk about vaginas and sex and penises and that sort of thing. So I just can't tell you how thankful I am for you. Thank you sincerely so much. Thank you for this live, and hopefully I will see you guys soon in the next video. So glad I got the notification. Me too, Naughty Naughty. Thank you so much. I'm getting emotional. It's the invisible onions. Oh, Isla, it's okay to get emotional. You deserve to feel peace in your body. Seek it out, okay? You deserve it. I'll always support you in every way. Thank you, Plain. Thank you, guys. And I will see you when I see you. The next video for the Overactive Bladder series, I'm editing it right now, so hopefully that will be up in a couple of days. And I'll see you guys when I see you. Have a wonderful rest of your day. Happy weekend. And thanks again for everything. Bye. Thank you so much for doing this live, and please do many more as I watch always. Thank you, Valerie. I think I know who you are, Valerie. Thank you so much. I really appreciate that comment. Bye, you guys.